This is Paw Print, an animal rescue community. I'm Harold Ree, and today we are super glad to have on our show as a co-host, Lorrie Shaw. Hi, Lorrie.
Hi, Harold. How are you?
Good. Well, I was just checking recently, and I do see that you've been on our show an amazing 3 times.
Oh, boy, and it's been a blast every time. Boy, the conversations we've had, right?
Yes, definitely very moving, and now you're sitting in the co-host chair. Now, you've introduced us to Dr. Kathy Cooney, or you introduced me to Dr. Kathy Cooney. What gets you so pumped up about Dr. Kathy Cooney, her background, and her expertise?
Well, Dr. Cooney is, she doesn't know this, but she's a vicarious hero and mentor of mine. She's really a pioneer in the industry of animal hospice. She's been a practicing veterinarian, I believe, over 20 years, and she really has a passion for not only seeing companion animals from their beginning when they're young, but into their later years, their geriatric time, and their end of life. And she has taught not only her clients and families so much, but other veterinarians and other professionals like myself as well.
Now, tell us a little bit about you, your background, and your blog.
I absolutely love what I do. I am a certified pet loss and grief companion, along with being a certified professional pet sitter who specializes in animal hospice and palliative care support with my business, Professional Pet Sitting. Through the experience I've had with all of that, I'm also the author of a blog called Animals Unfolded, where I share my journey and my experiences with the families that I work with.
Well, thanks, Lorrie, and here's Lorrie and Dr. Kathy Cooney. Tell us just a little bit about yourself, your journey, and what really gets you excited every day.
Sure. Well, I've been practicing veterinary medicine now for about 14 years. And going through veterinary school, I thought I would be either a dermatologist or maybe an oncologist, even fell in love with surgery. And then as I actually got into private practice right after graduation, that was back in 2004, I really found passion with end-of-life work and really loved getting to partner with families as they were making decisions, those very, very difficult decisions at this end-of-life time, hearing stories about their beloved pet and just getting to know them on a very intimate, personal level. And I thought, wow, this really speaks to me. So for the last 12 years now, I have focused my entire veterinary career on end of life and starting out initially with a business that I built in Colorado. It's called Home to Heaven, and it provided in-home euthanasia services. And then, a few years into that, I was finding that, the families that I was working with just didn't have a lot of emotional support and medical and physical support for their dying pets. And I thought, boy, we can do a lot more. So what gets me up in the morning is the fact that I can now partner with these families on an even deeper level and support them through terminal diagnosis of their pet's disease, all the way through the death of the pet, and then beyond, where I can support them in their bereavement period. So I'm very passionate about anything to do with end of life. I'm very much a veterinarian that's still doing day-to-day practice, but I'm also an educator and a consultant to help other veterinarians and other veterinary professionals at large be able to provide the same type of service that I do, which I can't imagine doing anything else.
Wow. Okay, Lorrie, take it away.
Well, Dr. Cooney, I am extremely excited to be talking to you because I have to say that you, as a lot of people know, you're a vicarious hero of mine. I have spent the past 15 years working as a professional pet sitter, certified, and through that time, I saw that families really needed a lot more support than just caring for their pets. I was being presented with a lot of cases where pets were very obviously in their end of life stage or in their geriatric years and needed a lot more support. And I had decided to join the International Association of Animal Hospice and Palliative Care, which I know you're a past president of. And you have taught me so much about the ins and outs. Not just the medical stuff is one portion of it, as I'm sure you'll agree, but it's the support for the families. That's really the biggest thing. So I'm really excited to share how you've impacted the work that I do, as well as the work of others in the industry, in the veterinary industry.
Wonderful. Thank you.
So I'm kind of wondering, I know that you had started to practice hospice and palliative care not long after you graduated vet school and had been in private practice. So is there an experience as a vet in working with hospice and palliative care that still resonates with you?
Well, there is, and one of the big kind of unknowns within the animal hospice and palliative care world is how much real world general practice experience a veterinarian should have before they go into this specialty.
Mhm.
And as you touched on, I did private practice for a couple of years right after graduation and graduation from veterinary school. And it was a busy, thriving private practice, small animal with dogs and cats mostly, and a few exotics. And that time in a general practice was priceless for me because when veterinarians graduate from college, from the university, which is usually a 4-year degree, it's very much the ivory tower experience, right? It's the best of the best. It's everything that's there. And then when you get into private practice, we really start to get to apply what we learned, but we also start to feel and connect with families and learn just the struggles that they go through every day with providing care, often for just general younger animals that might be have experiencing a trauma or an acute illness. But when we start to work with those families that are very much burdened with care, they might have financial limitations as their pet nears the end of their life, and now the pet has a lot more illnesses we call comorbidities, where they might have osteoarthritis, they might have then heart disease, there might be some kidney disease in the mix, or even cancers. Then everything starts to get that much more complicated. So what's lovely about just general practice work, first of all, is that we get to have a lot of experience with different types of diseases. And then when it comes time for us to focus in on advanced end of life care, where again, these pets are going to have a lot of these diseases at the same time, then we're more prepared. One of the things we talk about within the field of animal hospice and palliative care, like I alluded to, is that how much is the right amount of time to be in general practice before you just dive into hospice.
Mhm.
And I would say honestly that, and I think most of us would agree out there, that a couple years in private practice is important, or even emergency work. And then we start to, hone our passion and our skills into hospice. But as far as the IAAHPC, which is that International Association for Animal Hospice and Palliative Care, we actually have a certification program for veterinarians and technicians, veterinary technicians, so they can become certified providers of hospice and palliative care. And the first 2 years of that certification program, we did not allow veterinarians or technicians in unless they had 3 years of clinical work
Mm.
under their belt already. And hopefully, what's going to happen in the future is that the veterinary colleges start to provide more training in hospice and palliative care so that we can actually start taking in new graduates directly into a certification program like that. Because a lot of them are coming out of school passionate and ready to dive in. They want to get this advanced training, but we do feel like that background, experience in private practice is so important. But overall, what it does is that, these years in private practice, again, it teaches us about all the different diseases that are out there, how to manage them, how to work with families, getting familiar with all those what we call psychosocial, concerns or factors for our families that dictate what level of care they're able to provide for their beloved pets. And then we put that all together, and then we can, be that much better at the work that we do.
I have to say I agree with you. It is really taking in consideration not only what the pet is able to manage and what they're able to tolerate in terms of care. It also comes down to what the family can afford with their time and financial resources and mental bandwidth, which is a really important aspect of it. And those journeys can, you and I both know, can change along the way, and you'll have to change trajectory to see which one works best. So bouncing off of that, who would you say, or the best experience that you've had has been your best teaching experience in terms of that?
My best teaching experience?
Or the best teacher, the best human or animal, an experience that you had that would just really resonated?
So I'd say that a case that really shaped my future and helped me to find my calling was a case that I had when I was in private practice early in my career, well before I started just doing solo end of life work, is a case of an old hound dog with lymphoma. And lymphoma is usually an all over body cancer that's affecting white blood cells. And this particular dog, we were doing a lot of palliative care, our consultations, our rechecks, everything was in the clinic setting, was in our hospital setting. And that particular dog, I would have loved to provide more home care. And within animal hospice and palliative care, those of us out there doing the work tend to provide most of the care in the home setting. So he really got me thinking. This dog really got me thinking about, well, is this best for him? Is it best to bring him in regularly for these rechecks and doing everything in that hospital setting? And what else can we possibly provide for him in the home? And also working with this dog's family was having these more meaningful and more enriching conversations about what was important to them. What is it they were looking for his end of life journey, and what was going to be, again, their burdens of care. What is it that they were going to be capable of providing for him? And I really hadn't had a good experience like that throughout veterinary medicine, throughout my college education. Most of us that go through our university training, we're just kind of lucky to find the cases that we do during our different rotations, that can really, again, help to shape us and teach us. And I just didn't really have quite that experience in my training. So I got it in private practice. And that particular dog really, really did change me. And I found that I so enjoyed working with him and his family that I became known as, just kind of a geriatric doctor. I became known as the euthanasia doctor, where, these type of cases came up in that hospital that they would turf them over to me because I so enjoyed working with them.
Do you remember the dog's name?
The dog's name was JD, which stood for John Deere.
How sweet. Oh, boy.
Little coonhound, which are always special to me with my last name, Cooney.
Yes. I'm kind of wondering, given that experience and the experiences that you've had since with all the cases that you've overseen and the interactions with families, I'm kind of wondering, for families, what are the biggest challenges that you see them face when they are up against the need to have palliative care and hospice and end of life care? Is it the actual work that they need to do to put in to make this work? Is it maybe primary veterinarians that are maybe resistant to doing this? Time, support?
Yeah, I would say all of those things certainly, Lorrie, are going to be impactful, right? Are going to help to steer them in one direction or another. But when I start with a family in a hospice consultation, and just to be clear on what hospice is, hospice, we don't even use the term until we believe that the pet patient is dying, or we do have a diagnosed life-limiting disease that will either take that pet's life naturally within the matter of a few days to ultimately a few months. Okay, so we're thinking here about advanced heart disease, advanced organ failure, cancers, or where we've got such advanced age-related changes that we can start to see the patterns of death forming in front of us, because it's not easy to predict when a natural death will occur. So if a family comes to me, first of all, for a hospice consultation, it's because the pet has already been diagnosed with a terminal illness, or when we're on the phone with them talking about what's the best course of action, if they've just reached out to my company, for example, and they just want to know what their options are, that we can start to pinpoint to say, it sounds like this is a very serious, condition that your pet's going through, and we're going to start with a hospice consultation. The alternative is a palliative care consultation. And palliative care means basically it's medical support, medical management of anything that the pet's body is experiencing without a particular disease and saying that death is coming. So you can have palliative care without hospice, but you cannot have hospice without palliative care.
Correct.
So if a family comes to me for a hospice consultation, and let's just say that we know that, yes, the pet is terminal, that death is starting to approach, I would say one of the biggest challenges my families go through is acceptance of the fact that death is coming and to just take it day by day and not live in the future with heavy, heavy anticipatory grief of that actual death, because that anticipatory grief can be so crippling to the journey. It really puts a huge dark cloud over the experience, and it shifts the whole process. And again, it can be absolutely crippling. So one of my primary goals in any consultation I do is to figure out where they are in the spectrum of their grief already,
Mhm.
and how much this animal means to them. I find out what are their financial limitations. I want to know what their spiritual background is and what's important to them spiritually. I also want to find out what their previous experiences with illness and death are, and who else is going to be providing care in the home, and really all of their psychosocial factors, so that I can talk very clearly and succinctly with them about a good care plan. Because if we find through the course of gathering all that information that hospice care, really involved hospice care is not what they're capable of, then what we kind of do is we shift it and say, well, what we're going to do is we're going to try a few palliative things to provide your pet as much comfort as we can. But we're also going to put together a list of those factors that tell us when euthanasia is going to be necessary. Okay.
Mhm.
And that really helps them. It really shifts the perception of what the experience is going to be. It gives them a big sigh of relief to say, okay, now we've got a plan in place to say, yes, we want to move forward with euthanasia. We can't, carry on a lot of, lingering care where things might just get, too difficult for everybody.
Mhm.
And we're going to choose euthanasia maybe sooner or later. During that hospice consultation as well, there are going to be families that say, we're not really interested in euthanasia, and that we are more interested in carrying on care for as long as possible,
Mm.
and maybe give us a chance for our pet to pass peacefully on their own.
Mhm.
And that's a very different journey, right? It,
Right.
it really
Yes.
does come to be. And in fact, when I'm meeting with these families and talking about what's important to them, I ask them, what kind of death do you want your pet to have?
Mhm.
Because for so many years, the paradigm has been it's euthanasia or nothing, right? Like we
Right.
don't allow our
Right.
pets to pass naturally in their sleep or whatever the situation may be, because there's no guarantee that it can be peaceful. And with all the amazing palliative care that's out there now, so different than what it was even 10 years ago, 20 years ago, we can provide many times a very gentle, natural death for an animal if a family is able to completely walk that journey, which, to be honest with you, most aren't.
Right.
It's a lot.
It
It can
is.
be extremely intense. So it's very much a spiritual need for their pet to choose their exit time on their own. So coming back around to the initial question of what is it that I think is one of our biggest hurdles or challenges for our families, is to determine right out of the gates of what kind of death is it that they're looking for their pet, and then how can we meet those needs? How can we fulfill those goals with the understanding that euthanasia is always an option, and that if we get fortunate enough that the pet should pass peacefully on their own early in the course of the disease, great. But if they want to ride the full journey, and the pet is just kind of continuing on and on, as long as that heart is strong, everything that pet goes through can bring up challenges.
Mhm.
We as a team then, because hospice is very much a team, we have to meet those pets' physical and emotional needs at every turn. And we just simply have to take it day by day and try not to live so much in the future.
Exactly. And that really comes back to what I always emphasize with families are the 5 freedoms.
Yeah,
And that's the core of what is done in animal hospice and palliative care. Even in just geriatric years, we need to make sure that they have all of their needs met. And I think when when we focus on that, it always takes that focus off of how the humans are feeling about I can't do this or I don't know what this is going to look like.
right. It's very much about education. And one of the best things any end of life provider can do is help a family to understand what this disease or a multitude of diseases is going to do to the body. What are signs of crisis? What are
Mhm.
signs of pain? So that, again, they can just take a deep sigh of relief and saying, okay, I've got information now. I'm empowered to help ensure that my pet is not suffering, right? That's really what they don't want to experience. I will have families come to me for euthanasia very, very early in the course of a disease because they want zero suffering. Well, zero suffering is extremely hard to achieve unless
Yes.
you choose euthanasia, very early on in the course of the illness. But suffering, there's different levels of it, and we often find that our animals are able to bear lots of different maladies that they go through. But when it starts to impact so much of their life and what's important to them, such as being able to greet the family when they come home or to sleep comfortably through the night, you name it. We then as the providers of this care need to make sure that we're asking the right questions of our families, that we're really keeping a close eye on the pet themselves to see what it is that they're showing us so we can manage their needs. But Lori, you touched on something that I want to make sure that I get a chance to touch on too, and that is those 5 freedoms.
Mhm.
One of those 5 freedoms is freedom from hunger and thirst. And it's important that we consider the fact that a dying animal has physiological changes that reduce their hunger and can shift their thirst.
Mhm.
So I experience regularly a dying animal that no longer wants to eat and no longer wants to drink. And in human hospice, there's the saying or the concept of that water is for the living,
Mhm.
or that food is for the living. So we as hospice providers need to be very clear on what natural death looks like and recognize then when a pet is dying to say we need to stop force feeding or we need to stop forcing hydration, such as through subcutaneous fluids, where we're giving fluids from IV bags underneath the skin to help with hydration for certain pet patients that need that. Is to say, it's time for us to stop that and
Mhm.
allow death to start to come and to come more comfortably, because actually
Yes.
food and water can then start to be um, aversive and even painful.
Mhm.
And so I just wanted to point that out, that there is a shift that happens so that even though we have an animal that's no longer eating, it doesn't necessarily mean that it's lost a freedom. It is choosing not to do that anymore. Right?
Right. Because that also, I notice, as you say, families really want them to eat. And it's like, it's actually creating anxiety for the pet.
Mm.
Because they're like,
Absolutely.
I don't want that. I just want to be able to transition and get through this. Because it's hard on the body when it's trying to process the fluid and process the waste and
Mm.
digestive and stuff like that. So,
Look, our job, the key component here is to make sure that if they're not eating, that they're not eating by their choice and not because they're too painful or because they're nauseous or something else. So
right.
that becomes a real fine line for the providers, the veterinary professionals that are working these cases, is to say, okay, well, are they not eating simply because they're that close to the natural end of their life? Or are they too painful? Then we have to ramp up our pain medication. Do we need to make sure that we're providing, again, that anti-nausea control? Do we need to do a quick round of antibiotics to provide palliation to get them feeling better, even though we're not necessarily trying to prolong life? We're just trying to make them more comfortable during the dying process. And have you heard of the sixth freedom?
Yes, but I would love for you to highlight that because a lot of families have not heard of that.
And actually, if we could go over the 5 freedoms, I think that would really be helpful to listeners as well.
Yeah, Dr. Cooney?
All right, so I'm going to try to roll them off the top of my head here. I don't have a list in front of me. One of the freedoms is for normal behavior. We already said freedom from hunger and thirst. Freedom from, I think it's pain and disease.
Correct. Pain, injury, and disease.
And then there's freedom from distress, which distress has a different meaning than just like physical distress. It's more of emotional distress.
Yeah, the anxiety. And
then what's that last one?
We have,
freedom
there's
from discomfort.
hunger.
Freedom from discomfort, I think is
discomfort, hunger and thirst, pain, injury, disease. Normal behavior, they should be able to express that. And freedom from fear and distress.
Okay, so maybe I kind of rolled some of them into the other ones. The sixth freedom is the freedom to die a good death.
Yes.
And the freedom to die a good death was actually proposed by the bioethicist Jessica Pierce, and she wrote it in her book, The Last Walk, which does go over her full journey with the death of her own dog, Odie. But then she also talks throughout the book about death in different cultures and wildlife and just a whole myriad of different situations. It's a fantastic book. But she proposes the freedom to die a good death. And what that means is that the pet is as prepared as it can be to exit its body, that it is free of pain, and that it's a death that's meaningful. It's a death that's allowed to live a life that's been allowed to live its full course, and that now death is meaningful when loved ones are gathered around, and that the death itself is as gentle as possible. And I think that's beautiful.
Mm-hmm. It certainly is. And just so our listeners are clear, because this is a misconception that I get a lot in my work with families. When we first start talking, a lot of them express the fact that they want their pet to be able to experience a natural death. They always say, I just want them to be able to die naturally. And it can be a challenge to try to explain to them what a natural death actually looks like and what it entails and what it is not, more importantly. Because there are some disease trajectories that do not avail themselves to having a natural death. And one of the ones that comes to mind is like bone cancer, because that can be quite painful and hard to manage. So could you explain a little bit about what a natural death actually entails?
Sure. And I'll start with saying what most of my clients, my families, are looking for. So when I ask the question of how do you want your pet's death to be, what are you hoping for? 95% of my families and those within my company say that they want a natural death of their pet, but they are open to euthanasia. So in a perfect scenario, they wake up in the morning and they find that their pet has passed peacefully in the night. And who doesn't really want that? That's and I honestly can say about 2% of the population doesn't want that, because they, in our experience, will choose what's called a planned euthanasia, meaning that it's extremely important for them to be present for the death of their pet. And they really absolutely do not want to ever wake up in the morning or come home and find that their pet has died without them, as they feel that it takes away their closure, it takes away their ability to say a proper goodbye. And they also will worry that their pet did not die as peacefully as what they were hoping for. Okay. So very few will say that they want a true planned euthanasia. But most of the time what happens is that families want a natural death, and then they are open to euthanasia. Of those 95% that choose that, 95% of them choose euthanasia. And the reason being is that as much as we want our pets to pass peacefully in the night or during the day, and just, to have a high of quality of life as possible with a very rapid change towards death, it just doesn't usually work that way. What happens is the pet, through natural death, has to go through a dying process. Death is rarely ever an exact moment in time unless it's an acute heart attack or a trauma, right? That
Hmm.
takes them quickly. It is a process. The body has to go through very slow shock. And we think about shock when you hear somebody is shocky or they've experienced shock, they pass out, those types of things. What's really happening is a lack of oxygen to the brain, but in the death process, it's a lack of oxygen to all of the body's organs, including to the heart. So when our body doesn't have enough oxygen, and it doesn't, in a dying process, it doesn't get enough oxygen because the lungs aren't working as efficiently, the heart isn't working as efficiently, the organs, aren't able to, readily accept the oxygen like they used to because the cells are dying and they continue to die because there's no oxygen. It just continues to kind of spiral and spiral and spiral until the body can no longer compensate and death occurs. So normally a natural death, we can start to see symptoms of it, if you will, or signs of it about 3 months out.
Mm.
And then it starts to become a little bit more clear about 3 weeks out, and then 3 days and 3 hours. And there's books that are written about the natural dying process to help pet owners understand what's normal and what's abnormal.
Hmm.
You're really looking for death and watching for those signs. Those that are really highly trained can start to pick up on it again about 3 months out and so forth. But it's very much a process. And when it comes down to the active death itself, when we are now truly having that pet take its final breaths, that's very distinctive. And I like, if a family says to me that they want their pet to die naturally, I need to educate them on exactly what that's going to look like, right? Which, actual natural death, what's going to happen is usually before the pet takes its final breath, it's going to go unconscious. Okay. That's basically the brain death happens first. And that's actually what happens in euthanasia too. But natural death, usually the brain will go unconscious first. Then the breathing stops. And then the heart stops. And when the body is dying, the body will often give a big stretch.
Mm.
Well, the head and neck will go back, kind of arching towards its back. And the legs often go out straight and rigid. And if the animal has a tail, the tail often kind of raises and curls up towards the back. It's just a huge body stretch.
Mm.
Then the body softens, and then they get the what's called agonal breathing. And agonal breathing is a very deep reflexive breath that's stimulated by a part of the brain, kind of the brain stem area, to do reflexive breathing. It's just a normal action. And some of our listeners may have seen this happen during euthanasia. It can happen during euthanasia, but it's extremely common in natural death. So, again, the pet will go unconscious, then the body will often stretch, and then the agonal breathing can start. And that agonal breathing, which are those deep reflexive breaths, humans do it as well, that can last anywhere from 30 seconds to 10 minutes. Now, in human medicine, they report those agonal breaths lasting upwards of 2 hours, just
Ah.
because there's so much energy that needs to be dissipated out, and for whatever reason, the lungs are stimulated or the rib cage is stimulated to move, but they're not real breaths. They're just not real breaths at all. In fact, if you watch, it's more of the mouth opening and closing than it is that you see true chest, movement and opening up to take in air. It just doesn't really work that way.
Right.
But the eyes start to change. The eyes will glaze over, and then there can be urination and defecation and those things. But leading up to that active dying moment, the pet may be, semi-conscious or even unconscious for days. They can have moments of waking. They can have moments of agitation where then it's very important that the veterinary team has been giving sedatives and anything to provide comfort during that time. But most of the animals that I have worked with over the years for natural death, they completely disengage from their surroundings and they're ready to exit.
Right. Yeah. I think I've been lucky enough to have a couple of my charges be able to pass naturally in that way. But I think the real important thing that families need to remember is that this doesn't happen on its own. They have, the pets in the family have the support that they need from the clinicians or the host call vet and the pet sitters, whomever, family members even. But it's also, they are on medications. They are on uh, prescriptions and nutraceuticals. And I think a lot of families think that all of that happens in the absence of that because they don't want to use the medications. They don't want to have a doctor involved in having this happen. And that is one of the problems that I see a lot of times.
Yeah, there's a difference between just letting your pet die naturally and hospice supported natural death. It's very, very different. Now, that's not to say that a pet cannot experience a peaceful natural death without drugs and without intervention, because we might be early on in the game. Let's take an example of hemangiosarcoma, right? A blood vessel cancer that often resides or targets the spleen. And there's times where families are not even aware that this cancer is present, but their pet may have been slowly going through the dying process because they've been blood has been pooling into the abdomen, and therefore less oxygen's getting off to the tissues, and everything's slowly starting to shut down. But yet that pet can still experience a gentle natural death. But most of the time, with a lot of the conditions that are out there, bone cancer you talked about, there's a whole myriad of others, that those patients that we're anticipating or actively moving towards a natural death, that's our goal, they need medication, they need pain management, they need respiratory support, they need anxiety medications, because often the brain just isn't working as clearly as it normally does. That's normal with human hospice as well.
Right.
That's part of the comfort kits that we usually offer in human hospice, just to provide sleep and rest. So we do all of those similar things for our animal patients. And if we get to the point where natural death is the goal, and we've got an animal that is just not approaching it as peacefully and comfortably as we want, but that family just does not want to choose euthanasia for whatever reason that's important to them, we do have the option to provide what's called proportionate palliative sedation, wherein we can keep the pet in a very comfortable sleeping state until they do pass naturally on their own. And it is not because we're trying to necessarily facilitate death, but we're simply trying to keep the pet free of pain, free of anxiety, breathing comfortably until they are ready to exit their body. And that's very, very important. It is not something that a lot of my families reach for. Often when we get to that point where it's becoming clear that this death is not going to be as peaceful as what everybody is hoping for, and you alluded to before, there are simply some conditions that make it more challenging, or disease trajectories that don't lend itself to a peaceful natural death, then most of the time in that situation we are reaching for euthanasia.
Right.
Right.
Before Lorrie asks her last question, Dr. Cooney, what is the best way for folks to find you, whether it's online or social media?
Sure. Well, for questions or consulting, then I have people reach out to me on my website, Kathleen Cooney, DVM, as in drveterinarymedicine.com. So KathleenCooneyDVM.com. And here in the Colorado area, they can find me through a service I work for called Home to Heaven. But for all those listeners out there who aren't in my vicinity and are looking for wonderful providers of end-of-life care, hospice, palliative care, euthanasia services, and more, then the IAA HPC organization is by far the best resource. So again, that's the International Association for Animal Hospice and Palliative Care, and their website is the initials IAAHPC.org as an organization, so .org. And there we have a member directory and a service provider. And I would get on the service provider page and look up those providers that could be in the listener's state or community. For home euthanasia, which is a big component of end of life, I actually have a directory called inhomepeteuthanasia.com, and that lists home practicing veterinarians that will go directly to the family's home and provide home euthanasia for a pet, so they don't have to go into the hospital. There's more and more hospitals that are providing good euthanasia, trying to make it as peaceful and comforting as possible. But for the most part, we still advocate for that procedure to be done in the home setting whenever possible, just simply because it's better for the pet and much easier on the family that doesn't have to drive anywhere and experience that hardship. And I just also want to quickly say that last year I created what's called the Companion Animal Euthanasia Training Academy. And I founded that academy, it's called CADA for short. I founded that academy because we veterinarians, when we're going through veterinary school, we actually don't get trained on all the nuances of companion animal euthanasia, such as providing sedation ahead of time and all those best protocols to help the pet sleep in their final moments, and all the different euthanasia techniques that can be applied if one technique isn't going to be perfect for that pet, what are the other options? And information about caregiver preparations and pet considerations, all the physiology and pharmacology behind euthanasia. So I created that academy to train veterinarians how to do it better, but also that academy is open to anyone who wants to learn best practices in euthanasia. So if any of your listeners are a part of shelters and rescue groups, as I know is the target audience for you, and those that are pet sitters, those that are dog trainers and just behaviorists in general, this academy can teach you as much as you would ever need to know about euthanasia. It does not make you a euthanasia provider. Only veterinarians and certain veterinary technicians or shelter technicians can perform euthanasia, but it opens up a lot of eyes and builds awareness about what best practices are around euthanasia.
Right, and I think that's the most important thing, isn't it, Dr. Cooney, is education.
Awareness. Mm-hmm.
Yes, definitely. Well, Dr. Cooney, I wanted to ask you, I know I've had quite a journey in my career. I started out as a pet sitter, and then I became more involved. I'm a certified professional pet sitter. And then when I started working with families in end of life and hospice and geriatric, which is really my specialty, I love working with geriatric dogs, especially, and cats. My journey led to my being a certified pet loss and grief companion and working with these families. And I'm kind of wondering, when I look at my own history, how would you say that, what do you think, how do you think it looks like now compared to when you started, when you came out of vet school? What did you think your experience was going to be like as a veterinary professional, and how did it unfold?
Sure. And I think your experience is very similar to our listeners, or many of our listeners, that there has been an enlightenment, to say, wow, there's a lot of people out there that, well, millions, that are extremely bonded to their animals. And they are looking for more than what's been offered in the past.
Right.
Which is, your animal has a life-limiting disease, take these pills and call me when you're ready for euthanasia. And then after euthanasia, you might get a sympathy card, and that's it, right? The relationship is over, as far as, or I should say, the experience is over. But now, because our animals are so ingrained in our lives, and so many are filling the role of child, of a life companion as long as that animal can live, that we are so weaved with them. Our lives are just completely enwrapped with these animals that we need more than that. We need more support than what has traditionally been given, not only by veterinarians, but by grief counselors and the general public at large.
Yes.
Recognize just how meaningful this death is and how impactful it's going to be for this person who now has to transcend to a whole nother role in life, right?
Right.
So when I first started out, I would say that I was very blessed in that I went to Colorado State University, and client communication around death was very important. We were taught to absolutely respect the human-animal bond and to recognize that this might be a life-altering transition for a human loved one here that's experiencing this loss. So that was fantastic, and more veterinary colleges and veterinary technician schools and you name it are certainly recognizing that, no question. But as far as where I'm at and what I see from 14 years ago when I graduated is leaps and bounds different. And that we, through the work that we do with our families, are listening closer. We are paying better attention to their needs. We are partnering with them through that journey, such as we've got better communication strategy, and we've got better medicine that we're providing for these patients. But we're also using a much better team approach. So we're not putting everything, all the burden of care on just that family and the veterinarian. Now we're pulling in pet sitters, we're pulling in technicians, we're pulling in more care coordinators, we're pulling in the grief counselors to all be a part of that journey towards death together, right? And that's certainly a big component of human hospice, right? So we're patterning after what they're doing. So that's fantastic. That's wonderful. So when I started to talk to a family, I said, okay, well, who's going to be providers of care in the home? Who's our emergency contacts? Which veterinary clinics do you work with regularly now that I can partner with for refilling medications or doing rechecks and diagnostics and those things if I'm unavailable? Who can they call after hours in emergency? All that, that's radically different than what it was 15 years ago. That's a big shift.
Yes.
Then, of course, the other big shift is now that we've got these, I'm not going to call them specialists, but we have those that are highly trained in the art of a gentle death, wherein, certainly even 5 years ago, there was some movers and shakers and some early adopters of the process that were really starting to shape the field. But now it's available through certification of the IHPC that more and more can learn that. And lastly, I'll just say that as far as specialty is concerned, and a great advancement in the future is that we're slowly starting to make progress now for animal hospice and palliative care to become a boarded specialty for veterinarians, and that will then follow in line with what the human medical field has done, and that's just fantastic. But we've got more grief counselors, we've got those that are trained in just pets, so true pet bereavement, groups like the APLB, which is the Association for Pet Loss and Bereavement, groups like the PLPA, which is the Pet Loss Professionals Alliance, and Compassion Understood out of England, who is now doing some work here in the States. All of that helps to shift and change things for the better. We're so blessed right now.
We really are. It's a collective effort, isn't it?
It is. We got a lot of work to go, or a lot of stuff that still has to happen in the future to elevate it that much more. But we are off to a great start.
I think so, and I think one of the best parts about it is that it's also influencing human medicine.
It is, absolutely. There's a lot of sharing that's been happening, a lot of collective ideas that are moving around, and we can certainly benefit from each other's work. And I have no doubt that the human-animal bond is going to continue to thrive and develop and change over the coming decades. And it's up to us right now to start to build the foundation of that good end-of-life care, so that everything we're talking about right now, which is new and on the cutting edge, is going to be absolutely normal, absolutely normal in the next 10 years. And we can't imagine that we would have ever done it any other way,
All right.
Exactly. Gosh.
All right. Well, listen, I think, we don't want to take up any more of your time, Dr. Cooney. We're already.
I can talk all day, Harold.
Oh, there you go. Okay. We're going for the 5-episode stretch here. Okay. Awesome.
Yeah. And it's always a pleasure, Dr. Cooney. I've listened to your talks many times and I have learned so much. And I know that other people have too. So I don't think this will be any different.
Thank you. Thank you both so much for the opportunity. It's been an absolute pleasure.
Okay. Thanks.
Thank you, Dr. Cooney. We appreciate it.
Bye-bye.
Bye.
How'd you feel?
Oh, it was great. It was really good. She is such a great, she doesn't give the one-word answers like a lot of people do. She's very happy to share and fearless about it. And boy, I could talk to her all day.
Right. Now, what's the best way for folks to find you?
I can be found in one spot, make it easy for everybody, LorrieShaw.com. And that is spelled LorrieShaw.com.
I just want to say thanks to our amazing co-host, Lorrie Shaw. Yay!
Thank you, Harold. It was a pleasure. Always is.
We want to say thank you to Lorrie Shaw for being an amazing co-host and for Dr. Kathy Cooney, our special guest today. If you'd like to learn more about today's episode, go to our show notes at thisispawprint.com/169. You can also follow us on social media, Facebook or Instagram. Look us up. Our handle is thisispawprint, all one word. All the music you hear on Paw Print is composed, performed, and produced by the amazing Luke Gartner-Brereton. Find him at info.vanillagroovemedia.com. And remember, you spread a positive message of love and peace by rescuing an animal. Have a great day, everyone, and see you next time on Paw Print.
Is a production of EVER Education.
You can't handle the truth.